During this section, I will explain our health insurance plans. The Blue Cross Blue Shield plan comparison is available on the health insurance page of the employee portal, as well as on eCentral during your initial new hire enrollment process and during each annual open enrollment, which is held in May of each year and is effective with our insurance renewal on July 1st. The important thing to remember is that with our health plans, the coverage is identical no matter which plan you choose. The differences between them are the account that goes with the plan, the deductible, and the premium. Every covered expense, including prescriptions, goes toward the deductible. Our plans are all 100% plans, meaning that once the deductible is met, the insurance pays for all eligible expenses. The exception to this is if you go out of network, when you are then subject to pay 20% of those claims up to the out-of-pocket maximum, at which point the insurance resumes paying 100% of claims. There are two exceptions to this that I will explain along with the next two slides. Preventive items are covered at 100% upfront with no deductible. To see a list of what is considered preventive, check out the health insurance page of the employee portal. The VEBA 833 plan and the CDHP 860 plan both have the FlexRx prescription formulary. The CDHP 850 plan, which is the $5,000 deductible plan, has the GenRx prescription formulary, which is a little more restrictive in requiring generics for your prescriptions. Since these lists sometimes do change each plan year, the main thing I want to point out is at the bottom, which is the instructions for how to look up your prescriptions to see if they are on a specific formulary list. Once you are on Prime Therapeutics page, the pharmacy benefit manager for Blue Cross Blue Shield, select your appropriate formulary list and search for your prescription. You can also view alphabetic lists, updates, and more. To look up network information about doctors, clinics, etc. at mybluecrossmn.com, select the Aware Network under the Find a Doctor search. I do want to mention that this is not to say you will be required to take generics. If a certain generic doesn't work for you, there is still a process that you and your doctor would follow to try alternates, and if none work, a brand name could still be prescribed. If you have more questions on that process, please contact your doctor or Blue Cross Blue Shield. The VEBA and HSA Decision Guide is one of a couple different handouts that explain the differences between the VEBA and the HSA. I will explain the differences shortly. The handout also talks about embedded deductible, which means that one person in your family only has to meet the single deductible before the health insurance covers them. They do not have to meet the entire family deductible. Then the rest of your family members share what's remaining of the family deductible, and once that is met, all family members are covered by the health plan. All deductibles are calendar year for our plans. The other term I want to mention is fourth quarter carryover, which means that anything that is applied toward your deductible in the fourth quarter of the calendar year, October, November, and December, counts toward that year's deductible and is also carried over to the next year's deductible. For example, if you're healthy all year long and only used your insurance for preventive items, but had a skiing accident in December for which you paid $2,000 toward your deductible, you will also have $2,000 met toward your next year's deductible. Keep in mind that this is only for claims applied to your deductible. So if you met your deductible in June, for example, but still had medical claims in the fourth quarter, those expenses were paid for by the health insurance with no cost to you, so there is nothing to carry over. It is based on when the claims were incurred, not when you paid for them. The CDHP 850 plan, the $5,000 deductible plan, is the only plan that does not have this option. Here is another handout comparing the two types of accounts. HSA stands for Health Savings Account, and VEBA stands for Voluntary Employees Beneficiary Association. Both of these accounts are tax-free, meaning that all employee contributions are done on a pre-tax basis, all employer contributions are not taxable income, and any interest earned on the funds in the accounts grows tax-free as well. These accounts both roll over from year to year, transfer with you after your employment ends, and there is no use it or lose it provision like there is with a flexible spending account or FSA. Here are the differences between the VEBA and HSA. The VEBA can only be funded by the employer, SWWC contributes $50 per month toward single coverage and $100 per month toward family coverage for the VEBA 833 plan. The HSA can be funded by the employer, the employee, or both. I will talk about the contributions for the CDHP plans 860 and 850 later on. VEBA funds can only be used for what are called Section 213D eligible expenses, which include anything that is applied toward your health insurance deductible, as well as dental and vision expenses. The HSA funds can be withdrawn for any use, but if you use the money for anything that is not a Section 213D eligible expense, you will have to pay taxes on the money withdrawn, as well as a 20% penalty. If you withdraw for ineligible reasons after you turn age 65, you will still have to pay taxes on the funds withdrawn, but the penalty is waived. With the VEBA, you must prove any withdrawals are for eligible expenses prior to receiving the funds. With the HSA, you can withdraw funds at any time, but you must save your itemized receipts and other supporting documentation to prove that the withdrawals were for eligible medical expenses in case you are audited. The VEBA has what is called a coordination of benefits, which means that if you elect to put pre-tax dollars into a medical flexible spending account, or FSA, claims are all paid with the FSA first, since that has the use it or lose it provision. After your FSA funds are exhausted, any remaining claims will come out of the VEBA. With the HSA, there is no coordination of benefits unless both the employee and spouse have plans that are both HSA qualified. If you or your spouse contribute to an HSA, you can only set up an FSA for dental and vision expenses, which is called a limited purpose FSA. You would use your HSA funds for any medical expenses. While your HSA funds can also be used to pay for dental and vision expenses, a couple of reasons one may choose to do this are if they know in advance that they'll need their full HSA contribution for medical expenses, or if they would prefer to save all of their HSA funds for future expenses, but in either of those cases also know that they have foreseeable dental and/or vision expenses. The VEBA can be used to pay for post-employment insurance premiums such as COBRA premiums at any age, including early retirement. The HSA can only be used to pay for Medicare's Part B and D and Medicare Advantage and cost plans after reaching age 65. Beneficiaries are also set up a little bit differently. With the VEBA, your medical dependents are your primary beneficiaries, and then you can designate other beneficiaries if you have no medical dependents, or to set up contingent beneficiaries. This account becomes a taxable event to anyone who is not a medical dependent. With the HSA, you can designate anybody as a beneficiary. If your spouse is designated, it will become their HSA upon date of death. If the beneficiary is anyone other than your spouse, the account ceases to be an HSA and becomes taxable gross income to the beneficiary in the year of death. These two accounts are set up with different legislation, so if you switch health plans at open enrollment, the account associated with your new health plan is the active account, and the other must become a limited purpose account for dental and vision only. Dollars cannot be rolled from one account to the other. Both of these accounts may also be locked if you wish to have no claims paid from them in order to save funds for future medical, dental, and vision expenses. You may also invest in mutual funds after you have a balance of $1,000 in your account, and you may receive a brokerage account with Charles Schwab representative assistance after you have $10,000 in your account. Visit hellofurther.com for more information. On the insurance page of the employee portal, under Further Educational Material, you can view a variety of other resources that further explain VEBAs, HSAs, and more. This spreadsheet shows an example of the cost per plan by bargaining group. The spreadsheet gets updated each year and can be sent to you for your specific group, so it's not as difficult to read as this agency-wide version shown. Please email me if you'd like a copy. When you go through the eCentral enrollment process, it will also update based on your plan elections what your per paycheck cost will be. All groups have at least one 100% employer paid option for single coverage. Please note that there is an administrative fee that Further, who processes all VEBA, HSA, and FSA claims, charges per month. This fee is the same no matter how many of these different accounts you may have, and it is deducted from your paychecks on a pre-tax basis, as are all of your insurance premiums. Here is an example of the bargaining group specific insurance paycheck deduction spreadsheet. It also has scenario comparisons to assist you in choosing the best plan for your family. While the deductibles do vary between the plans, the premium savings and contributions do make the plans more similar in total cost. In this example, with the VEBA 833, the current deductible is $2,600 for single coverage, and there is no premium cost to the employee. Since SWWC contributes $600 toward the VEBA, there is $2,000 remaining that the employee must be responsible for should they meet the full deductible. Best case scenario, they have no deductible met and a savings of $600 in their account. This is the case for all single VEBA 833 plans regardless of the bargaining group. In this example for single coverage under the CDHP 860, there is again no cost for the premium to the employee, and the single deductible is $3,375. The negotiated contribution toward the account for single coverage is $906, leaving $2,469 for the employee to be responsible for should they meet the full deductible. Best case scenario, they have $906 in savings in their account. In this example for single coverage under the CDHP 850, there is again no cost for premium to the employee, and the single deductible is $5,000. The negotiated contribution toward the account for single coverage is $1,812, leaving $3,188 for the employee to be responsible for should they meet the full deductible. Best case scenario, they have $1,812 in their savings account. For family coverage, the VEBA 833 costs $4,219 in premium to the employee with a $5,200 deductible. Since SWWC contributes $1,200 toward the VEBA account, the employee would be responsible for the remaining $4,000 in deductible cost. So in the worst case scenario, their total cost for a year would be $8,219. If they did not meet any deductible, they would still have the cost of $4,219 in premium, and then they would have a savings of $1,200 in their account. If one family member meets the deductible, they would again have to pay for the $4,219 in premium, but only $1,400 of the $2,600 single deductible, for a total annual cost of $5,619. Family coverage under the CDHP 860 costs $2,407 in premium with a $6,750 deductible. Since the employee can put money into an account under this plan, SWWC applies the $1,200 account contribution toward the premium instead to help make it more affordable. Therefore, there is no account contribution for family coverage under this plan, and the employee is responsible for the full deductible cost. In the worst case scenario, their total cost for the year would be $9,157, which is the total premium that the employee is responsible for, plus the total deductible. If they did not meet any deductible, they would have a total cost of $2,407 for the premium alone. If one family member meets the deductible, they would have to again pay the $2,407 in premium, but only the $3,375 single deductible for a total annual cost of $5,782. Lastly, family coverage under the CDHP 850 in this scenario is free, as the total SWWC contribution is higher than the family premium. The remaining $191 of the total contribution then goes toward the account the employee selects. In the worst case scenario, their total cost for a year would be $9,809, the $10,000 deductible less the $191 account contribution. In the best case scenario, where they do not meet any deductible, they have an account savings of $191. If one family member meets the deductible, their total cost would be $4,809, which is the $5,000 single deductible less the $191 account contribution. These examples only show account balances for 1 year. If there are previous savings in the account, or if you have an FSA in addition to your VEBA that is not limited purpose for dental and vision only, these would also help offset any cost should you have any deductible expenses. This handout from Further and the Minnesota Healthcare Consortium explains your options with our CDHP plans 860 and 850. Each employee enrolled in either the CDHP 860 plan or the CDHP 850 plan will have the option to choose where their employer contribution is submitted. There are three options: 100% to a VEBA, 100% to an HSA, or a 50% 50% split to both accounts. This flowchart shows how your selection affects your accounts and/or additional contributions. If you choose to submit your employer contribution 100% to the VEBA, you can choose whether or not you wish to also contribute to an HSA. If you do not want to contribute to an HSA, your VEBA can either be frozen for future medical expenses or active to be used for your current medical, dental, and vision expenses. You may also elect contributions towards your Medical Flexible Spending Account, or FSA, to pay for these items. Remember that everything will be paid for out of your Flex first, since that's use it or lose it, and once your Flex is exhausted, claims would be paid from your VEBA, since that rolls over from year to year. If you choose to also contribute to an HSA with the 100% VEBA option, you will need to either freeze your VEBA or have it be set as a limited purpose account for dental and vision expenses only. You can then contribute up to the IRS maximum for your HSA. If you choose either of the other two options, where all or half of the employer funds are going toward your HSA, your VEBA must be either frozen for future expenses or set up as a limited purpose account for dental and vision expenses only. You may then contribute to your HSA up to the maximum allowable contribution limit, less any employer contributions. This maximum allowable contribution is a calendar year limit since it is associated with your tax return. To see the most recent IRS maximums, visit the health insurance page of the employee portal. You may also elect contributions toward your medical FSA, but it can only be used for dental and vision. Your HSA is the account that will be used for any medical out-of-pocket expenses. You can freeze your VEBA at any time with the VEBA account option form available at hellofurther.com. So what are some reasons why a person would take advantage of this combo plan? Here are a few I can think of, but this list is by no means all-encompassing. Number one, VEBA can be used to pay for early retirement insurance premiums pre-age 65, where the HSA cannot. Number two, you want to maximize the amount of funds you have for future medical expenses. If you elect 50% or 100% of your employer contribution go to the VEBA instead of 100% to the HSA, you can contribute that much more toward your HSA. Number three, you want to have your employer contribution submitted to the VEBA, but prefer to have a higher deductible in order to save premiums. And number four, you want to have employer funds go to the VEBA so that it coordinates with your spouse's insurance better, as VEBA and HSA plans are not completely compatible with double coverage. If you find yourself in that unique situation, please contact me to explain how the accounts coordinate and to assist with your decision. If you enroll in the VEBA, your account is automatically set up with no additional information required from you. However, if you will have any HSA contributions, either employer funded or by your elected contribution, you will need to complete the HSA application to get your account set up. This can be found on eCentral in the documents or on the employee portal. Please return this form as soon as possible. It can be faxed, mailed, or emailed to me. Keep in mind that SWWC's emails are secure to each other, but you should never use your personal email account to send confidential information such as your date of birth or social security number. During the eCentral process, you will have an opportunity to make your initial HSA election. This can be changed up to monthly by completing the HSA Employee Contribution Election Form, which is available via AppleTrack. Instructions for AppleTrack employee forms are available on the Forms page of the employee portal. You can also contribute to your HSA outside of a payroll deduction by withdrawals from your checking or savings account, sending in a check, or as part of your tax return process. While there is a maximum contribution that can be made each tax year, the contributions towards the previous tax year can be made as late as April 15th. You will automatically be enrolled in Crossover unless you elect otherwise. Crossover is the automatic reimbursement feature of your accounts. The way that crossover works is if you go to pick up a prescription, they will look up your insurance card information, see that you have an FSA, VEBA, or HSA, and automatically draw any funds available up to the amount of your total cost, so that when you pick it up, you only have to pay any remaining balance or nothing at all if you have enough money in your account to pay for it. There are then no claim forms to fill out. It is similar if you visit a clinic or hospital, except that after the explanation of benefits, known as an EOB, is processed, you will automatically be reimbursed for the amount that you owe for the services after all of the Blue Cross Blue Shield adjustments with the provider have been made. You will then pay the provider with these funds when you receive their bill. This process saves on paperwork and filling out claim forms. As a reminder, if you take advantage of crossover, please sign up for direct deposit in order to expedite your reimbursement. This may be done on Further's website or by completing an authorization for direct deposit form. This is separate from your payroll direct deposit and is available on the employee portal. An alternative to crossover is to sign up for a debit card. This can be done on Further's website or by completing a debit card participant request form available on the employee portal. You can then use this debit card to pay for any medical, dental, or vision expenses as the bills are sent to you. Here's the contact information for Blue Cross Blue Shield of Minnesota, as well as Further, the company that administers the FSAs, HSAs, and VEBAs for SWWC and Blue Cross Blue Shield. All resources discussed about health insurance can also be found on the insurance page of the employee portal at www.swsc.org/insurance.